I'll actually never forget, I was actually sitting charting in the emergency department at my computer, and I heard a thunk, a really loud thunk. And I was like, what was that? I turned around and I saw one of my nurse's frail bodies laying on the floor. And I saw standing over her one of our patients, her patient who she had been caring for, who had really hit her in the face with his fist and knocked her out cold. And, at that moment, and I'll never forget it, everything stopped. Those are the things that we see way too often and live with. I can tell you, me personally, where I position myself when I'm working in the emergency department, I'm mindful of it. I'm mindful of not sitting too close to the door if I can, things of that nature. But absolutely, it weighs on you. People who are not in healthcare may be shocked to know how every single day in our emergency departments across the country, there's violence towards healthcare workers, actually at crisis proportions, that's really preventing us from being able to provide them, the public, with the care that they need. So we need to pass the SAVE Act because we are hurting in the healthcare profession. We need to have a federal piece of legislation that says that there is no tolerance for violence against healthcare workers who are trying to provide care. We're needing that piece of federal legislation, in many cases as a model for state level legislation, and also to really make it clear that at the highest ranks, this is really not tolerated. It's really basic courtesy and respect as we as healthcare workers do our job.